You are live.
Good afternoon, everyone. Welcome to the Jefferson County Health Department Board of Trustees meeting for June the 27th, 2024, 4 p.m. I appreciate it for everybody with silence their devices while we're in the meeting. Trying to keep those voices down to a minimum. I'm going to call this meeting to order. Roll call, please, Ms. Baker.
Mr. Page,
I'm here.
Dr. Henry, here. Ms. Siddle. Mr. Beal.
Yeah.
Ms. Taylor, here.
Ms. Stidham is excused. Please make that in there to know she called me. She's the details on it. I'll let her do that, but it's a proper issue. Ms. Stidham, would you please read the mission, vision, and purpose?
JCHD will champion positive health outcomes and behaviors through innovative programs and community engagement. The vision is advancing the health and safety of Jefferson County. And the purpose of the health center is that JCHD is established, maintained, and operated for the improvement of health of all inhabitants of Jefferson County.
Ms. Henry. Now we have a call for the orders of the day. First is the approval of the agenda. Do we have a motion to approve the agenda as presented?
So moved.
Second.
First and second, is there any discussion on the matter? Not hearing any, all in favor, please say aye.
Aye.
Any opposed? Motion carries. Welcome with guests, and we have more of the staff and their leadership guests aware of. We have a local leader here. So next on the agenda is approval of the May 24th, 2024 meeting minutes. The meeting minutes.
I'll second.
We have a first and second. Is there any discussion on those minutes? Hearing any, all in favor, please say aye. Aye. Any opposed? Motion carries. Next on the agenda, approval of the May 2024 expenditures for $312,569.50. Have a motion.
I move to approve the May expenditures in that amount.
I'll second.
First and second, are there any discussion points? Not hearing any, all in favor of the motion, please say aye. Aye. Any against? Motion carries. Next is approval of the May 2024 electronic payments for $501,140.35. Have a motion.
I move to approve those electronic payments.
I'll second.
First, second, is there any discussion points?
I was just looking to see. It's a relatively high amount. I didn't see anything.
Yeah, we haven't seen. We points good time. So this is for the May 24th electronic payments, $501,140.35. All in favor, please say aye. Aye. Any opposed? Motion carries. Next on the agenda is pre-approval for the July 24th electronic payments for $597,648.80.
Make motion to approve. Pre-approval of the electronic. I'll second.
First and second, is there any discussion on the matter? Not hearing any, all in favor, please say aye. Aye. Any opposed? Motion carries. That brings us to the director's report, Mr. Sykes.
Thank you. I think Jenny handed out an updated version. Apologize, I forgot to add something in my first version. So, a few updates. We're going to talk a little more on strategic planning. The admin team, we locked ourselves in a room for a whole day and, tried to work to get this, strategic plan completed. I think we made tremendous progress on that. And we'll discuss it a little bit later. It's under new business. Also in May, we met with, Jim Wallace and, Amy. What did Amy? Can't remember her name. It was two individuals from Chestnut that came and met with admin team, just discussing the collaboration that we have with them right now. Tara is with Chestnut. She's gonna speak later on some of the things that she's been doing here with us at the health department. But anyway, we just had a good discussion. I think it's just another way of working with our partners in the county on our programs and how we can collaborate with one another. Little update on the board emails and iPads. We do have the iPads ready to give out. But you have to do one thing, you have to send actually two couple things. You have to, it's in the training, and we're gonna have a policy on those. And just for the, make a note to make you all feel bad, you know, Mrs. Taylor has already attended hers. So, but I hear you all, everyone's are signed up for. Yeah, I appreciate
There'll
it.
be food and refreshments,
Yeah.
entertainment, right?
No.
Yes.
No, nothing, water,
That's what it takes.
bring out water.
So anyway, we had those, like we discussed last board meeting. Update on the hail damage that we did sustain. We have 10 cars that have been completed as far as the repair. Out of the 21 vehicles that did get hit, we have 10 of them completed, so that's going real well. We're working right now on the HVAC units on the roof. We have 6 units and 5 received damage. 2 of those, the insurance adjuster said we need to go ahead and replace. There's a third one that we feel we could repair it, but it's so old that, and to replace it is only a few $1,000 more, so we're gonna look at maybe where we can get some funding to go ahead and cover that difference and go ahead and just get a new unit. But we're working on the RFPs that we'll have Christie review for us, and then we'll send out RFPs and have all this done by one vendor is our goal. So a lot of damage on those, and some of those units are really old, so they said it's better just to replace them than to repair. And Steve Crawford working really hard on that project. It's a lot of moving parts, so doing a good job on that. The reason for the update is I forgot to add in this last board meeting, we asked the board to approve our submission of a grant for the CASA grant. That's a comprehensive opioid stimulant substance use program. And we told you that, you know, the original budget request was $675,000 over 3 years. We've had a couple more additions to that grant that we'd like to put in, which is going to increase the budget. And I asked Jackson to come in if you guys have more questions on these. A couple of things that we want to do. We're working with the sheriff's office to get a bigger incinerator. They have a small one now that they use. But through this grant, we feel like we could purchase one, or they would purchase and we reimburse them. Somehow we would work that out. Get a bigger incinerator for the drug take back program that they have, and they can incinerate on site, and which is falls right under what this grant is wanting to achieve. And then the other thing is, they stress with this grant that we should get a third-party evaluator, and they help us with the submission of the grant, but they also will help us during the grant, with how to make it sustainable past this grant period, how we're going to move on, and they'll do reviews. Is it like quarterly or
We're meeting quarterly, and then we ask for yearly like a yearly.
So that was some extra funding that we feel is money well spent if it can help with the sustainability of the program. So, Jackson went and talked to Kristen and they worked the budget and was able to keep the increase under 100,000. Even though the two projects would probably be more than that, there were some ways they adjusted within the existing budget. Well, 100,000. So just letting you know that we're going to be submitting a little bit higher budget on that. You might have any questions on that?
When's that due, Steve?
When's that due?
When is it due? So the first part of the submission is due, basically the total budget number is due July 1st. Which we have basically the form ready to go. And then the narrative due July 8th, which we have put those.
And when do we get notice if it's approved?
They don't have a date on it. It starts October 1st. It's a 3-year grant, so ideally a month or two before that, but they did not mention it.
Thank you.
Some ongoing projects, again, for strategic planning, but we feel like that's gonna be, hopefully be knocked out real quick. With the job descriptions, we're pretty much completed with those. They're in the final review with us. And then that'll help us align up with our job appraisal. And we're actually looking at reformatting how we do the appraisals as well. Working on those two together. Then our compensation study is also still in progress, but we're seeing light at the end of the tunnel on this project as well. What we feel where we're at is we have a meeting in July with the vendor that we hired to help us on this to discuss recommended options of implementing the compensation adjustments. And so we'll look at that internally, and then we will sit down with the personnel committee to review those options and our recommendation, and then we all can submit what you feel is right to the regular board for approval. Does that seem like a good plan on that? Right. So hopefully after July, when's our meeting?
July 16th.
July 16th, we'll be contacting the personnel committee members to come meet with us on that. And then, again, the new building, which I have a report here, on that. We're still working on that, but we're making progress on the new building. So that's all I have on our report.
I see that building report said they lost some days due to weather, so is that gonna change the completion date?
Well, yeah, it did from the original date. It's in April right now. Now, the contractor and the architect feel like they may make up some time once they get the concrete all forward. There were so many unknowns at the beginning that we're almost through all that. Yeah. I've got it. Show me a different. That's it. Thank you. It's small.
Good afternoon. You have a copy of your clinical services reports. The one area that I was hoping to highlight today is the Chestnut collaboration. Mr. Sykes spoke a little bit about that and some meetings that we had, but in your packet, you'll notice that there's an outline of what we've been able to do since we started the collaboration in February. The MOU was approved. We did work directly with Chestnut to get a community health navigator hired. That community health navigator was able to begin training both with us and with Chestnut. So just as a reminder, that person is an employee of Chestnut, but works on site at our JCHD locations and mobile clinics. We started doing a direct referral process directly out of our EHR system that, connected directly with Chestnut. So that way we could pass that information between the systems. We started with community engagement and having that community health navigator on site here in Hillsborough first and with our mobile team. And then that expanded to the Arnold location. We also began on April 15th, an agency-wide social determinants of health survey. So when clients come in here, they have the opportunity to fill out that social determinants of health survey that most healthcare locations are now participating in that, but it helps us identify what resources our patients might need. And then that social determinants of health survey is then passed on to our community health navigator to be able to help that individual find those resources a lot of times while they're still here, or connect them with those resources, provide education, whatever the case may be. So we also worked on developing documentation practices. And so you'll see a little bit of the data on this report. So since we started this collaboration, we've been able to work directly with 106 patients. We have increased how we're able to do that just in the last month. That social determinants of health survey has really helped us connect. And we've been able to have Tara participate in a lot of our community events that we're going to and all of our mobile teams. So I wanted to introduce Tara Lang. Tara is our community health navigator, and I asked her to speak to you all about maybe some impact we've already seen from this collaboration and partnership. So I think she has a couple of case situations that might really be able to show how we've been able to make this work. Tara, come on up.
Thank you. Thanks everybody for having me today. A little bit. So gosh, where do I start? So with my role, I think it's important to understand kind of that partnership I have with the nurses and all the teams at the health department. I started at the Hillsborough office and then in April started kind of expanding into the Arnold location as well. So when that referral comes over, a lot of times if they're still in office and have time to speak with me, I'll do that on site. With this position, I have seen every type of situation. The nurses and the teams that are working here, gosh, such a diverse set of circumstances. You know, you have domestic violence, you have homelessness, being housed, you have long traumas, and so that's really kind of where I step in and assist. So just to kind of give you a few different examples, there was a young lady that's pretty known around JCHD. She's been coming here for a long time, was under the influence of some substances. Told the nurse, she was here, for other services. She had an ankle monitor on while she was here. Didn't have a lot of time to be seen, didn't have a lot of time to talk to me, but we were able to connect. During our conversation, she did let me know that she was considering, and I said, okay, got it, we're on it. My first one, by the way, never done that before, and that's okay. But in the shop, you learn different things, and one of the things I've learned is as the temperatures increase, all the facilities will be full, because you have all those people who are maybe unhoused and things, and that is a bed to sleep at night, a detox center. So on my own, trying to call different detoxes, I have connections within the community. Wasn't able to successfully get her in right away, but was able to make a connection with PreventEd, with a peer support there. And she put in a line for me, and we were able to find her bed. Separate from that, she didn't have transportation, so that's another barrier. She's under the influence of some substances, and so We were able to find her transportation, and peer support also gave her a ride to Utah. And I was able to kind of keep connected with her. I know she went in, she was clean. As of a few weeks ago, she's good. She's in a good spot. So that was a really cool success. You know, she didn't have transportation. She just kind of came in here for other things, and we were able to get her in. So that was really cool. Another good example, I think, just from this week, we had a gentleman just walk in unhoused, had no place to go. Didn't have any IDs either. And so was able to kind of sit with him for a little bit, talk to him, kind of go through his story. He was in the House Springs area and had an ex-fiance drop him off here, kind of give him a ride. Wanted to stay in that area, so finding shelter, at an unhoused shelter, you know, he wasn't super interested in it, but he did need an ID. So that's something I'm working with him on through a resource called Vital ID. To get him ID so he can go back to work in different things. But during our conversation, he let me know he had an meeting over 24 hours. And so I was like, okay, great. Well, that's okay. Let me make some phone calls while you're here. And so put in a call to Hillsborough Food Pantry. They were already closed for the day. They did answer my call, and they gave me an emergency box of food. And I said, okay, give me 5 minutes. Let me just run down there and get you that box of food and bring it back. And so his ex-fiance had a car so that they could transport the food and everything. And so that was just from this week. Literally 30 minutes ago, I was just on a call with a mom. She is unhoused with 4 kids, Hillsborough School District. They're staying in a motel right now. Set of difficult circumstances. And so working with her to kind of help navigate some different resources for her regarding housing and some other connections in the community. But every day, this is every day. You know, there's probably anywhere between 2 to 6 referrals that come in a day where it's a set of, crisis circumstances. Sometimes it might just be a Medicaid application. Sometimes it's a mom with 4 kids that needs a house. So I feel like this role has made such an impact on the community. I feel very called to do this work. Take pride in knowing that every night when I go to bed, I've made a difference in this world. And so it's just been a really good thing. So that's it. That's all I want to share today. And I have some business cards if you need them. So I'll just kind of pass this around if you guys need anything.
Thank you, Tara.
Thank you.
I did want to brag just a little bit on Tara. She does a fantastic job. Having this partnership, it could be a little awkward having someone who's not an employee in our facility working through these things. It has not in any way been that we've been able to work through all of these difficult situations, and she is just doing a wonderful job of connecting with our patients and filling a gap that we had for a very long time. That's all. You guys have any questions?
I have a question, may not be directly related, but there's a family in Jefferson County who's been exposed to severe mold, and they're hospitalized, and they rent, and they're scared to report it because they think they're gonna be kicked out of the house. Is it something the health department would?
I'm gonna look to Tara on this.
Okay.
So that could be, I mean, it's a conversation, right? With that family, I'd be happy to talk to them and just kind of understand the situation, the circumstances. You know, I don't know if they've talked with their landlord before about it and if they could relocate to a different apartment or house or what, you know, so it'd be just kind of working through those things. But like with this family with 4 kids, I just try to kind of think quick on my feet and then there might be some other rental options too, that it's like, gosh.
Is there a process where they file a complaint or not? Or no?
They can probably.
I don't know how that would work.
Yeah,
You know?
There's landlord tenant laws.
Yeah.
You'd have to go at that.
Yeah.
Legal action. We don't get involved with.
Those are on our website too. You can download them on our website, the landlord tenant laws.
Okay.
But for me, I would kind of think like outside of that, like how can I directly help this family?
Mhm.
And so if it's just researching new apartments or houses or something like that, or maybe working with Salvation Army or St. Paul or someone who might be able to kind of help from a financial standpoint.
Those are just causing hospitalizations of them or the kids.
Yeah.
It's serious.
I know our environmental program really doesn't have any legal authority to do anything with that. It's a common problem.
We get calls on that. We had an indoor air program years ago, but it was just a very difficult program to handle.
Right.
There's a lot of legal parts of that that made it hard.
I've seen landlords supposedly clean them up and then sell the house. And knowing the people who are purchasing it, that, you know, they had hazmat come in there and clean it up before you actually bought the house. You know, so it occurs.
Yeah.
They're legally supposed to report that or to make it known, but that doesn't always happen.
Right.
Um,
Look at that.
And that's a common problem for renters, that they're afraid that can happen with lead exposure or substance exposure, you know, that they're afraid they're gonna get evicted, and that's always an issue.
There's an agency. What is the agency that has funding to help renovate? Is it- Yeah, they have funding to help renovate, and I think they will look at rental property as well. So if it's,
Yes.
yeah.
Mhm.
The Healthy Homes
Hammers.
program?
Yeah.
Yeah,
Yeah.
well, that one too.
The community partnership.
Yeah.
So there are, even the landlord, if they're having problems with.
The cost of
Yeah.
kind
They can look at those funding opportunities.
right.
Okay, thank you.
Any further discussion? All right, next on the agenda is public comments, and do we have anybody for public comment? Following that would be, rebuilding updates.
Yeah, I just gave it all away while ago. So we had, I apologize, the day of our board meeting, we had a building meeting that morning, so I get more information than what goes in the report. But if you haven't been by the site, it looks a lot different. We have half of the floor has been poured. The whole floor was supposed to have been poured by yesterday, but we had a,
2 inches and 2.5 feet.
yeah, we had some rain, which pushed that all the way back to, I think Monday, they're gonna try to get the entire floor poured. And then actually next week, start with the, putting the steel up. They call it the red iron, installing. That'll be about a 3-week process, if I remember what they said today on that process. So we're gonna see a lot of changes here real soon. The rock and trenching is almost all completed. There's just a small mound of rock and soil left. So that part's moving along. You can see how the site's gonna lay out now. Out there. So you can pull up on that main road and kind of look out and see the concrete. You talked about, we've lost 21 days. April 11th is the day they gave us. They may make up some days as we go. I think our weather delays will probably start to slow down a little bit, or they'll have better working days. And once they get the roof on, then things can really go. So I feel like now we're kind of over that hump of the unknown with the rock and the trenching. So we should be moving along on the schedule they gave us. Any questions about? Some of the staff went up and got to sit in a bunch of different chairs, do chair selection, and I think they had a good time. So I believe we got a budget back on that. I haven't looked at it. We got it. Yeah, we got it today. They didn't give us the actual, they just told us where they thought it was gonna be at, and they're gonna provide us what the actual dollar figure is for the furniture.
New board chairs.
Any questions on the building?
Thank you. Thank you very much. Next on the agenda is closed session. We do not have a need for closed session. So we'll jump right into new business. Portion of the business actually, this part is the old business, but the second reading, so we have on the agenda is the second reading and approval of the resolution regarding disclosure and conflict of interest pursuant to section 105.485. I will read the first four paragraphs, they're short. Jefferson County, this is the Jefferson County Health Center resolution regarding disclosure of conflicts of interest pursuant to section 105.485 revised Missouri Code. Do we have a resolution number for this yet?
Yes. It's 24-06-27-01.
It's 24062701. Whereas public officials and employees must be independent, impartial, and responsible to the people in order to effectuate the proper operation of the Jefferson County Health Center. Whereas government decisions and policies must be made in the proper channels of the government structure, and whereas no office within JCHD should be used for personal gain. Therefore, be resolved by the Board of Trustees of the Jefferson County Health Center. So, what day is 27th day? Thank you. Of June 24th, sorry about that. That the following procedure for the disclosure of certain officials and employees of private financial and other interest in matters affecting the political subdivision be affected immediately. And then there's a list of provisions of what that's going to happen. Basically, this is just saying you have to disclose your conflicts of interest. We have to do this
Every 2 years.
every 2 years. Thank you. So I'm looking for a motion to approve the second reading and final reading.
I'll move to approve the second reading.
I'll second.
And
We have
three readings.
we have a first, no, just two.
Just do it.
This will be the second final.
Okay.
So we have a first and a second on this reading, the final reading. Is there any discussion points on this? Not hearing any, I'll ask for a roll call vote, please.
Mr. Big,
Yes.
Dr. Henry,
Yes.
Mr. Deal,
Yes.
Ms. Taylor. Yes.
Thank you. So on the second provision, as is allowed by our own rules, this is going to be a one read for a reason only. So this next one is a resolution, and it is for authorizing Jefferson County Health Center to provide mosquito control services to the city of DeSoto, city of Hillsborough, and the city of Kingswood pursuant to an intergovernmental agreement and authorization for me to sign that agreement. Obviously, we need to have this to be a one read, because if we let it go on, the mosquitoes are going to be, really bad. So it needs to be a one read for just the proper execution for that to happen, so we control the vector control. Anybody need to have a first or second for this?
I'll make a motion.
Second.
We have a first and second. Do we have a resolution number on that?
Three resolution numbers?
Ah. One for each one.
Yes.
Got it.
24-06-27-02. 24-06-27-03.
Right.
And 24-06-27-04.
Yeah, are those for, are you gonna tag those to DeSoto,
Yes.
Hillsborough, and Kinslow respectively?
Yes.
So as they're listed actually in the agenda is the order that they're listed. So there will be three different resolutions. We're doing them as one package.
Correct. So like what's gonna be filled in is the name of the municipality and then the fee
These
That were-
resolutions are for us to provide the vector control mosquito spraying in those cities.
Is this because we weren't providing it before and they're asking us to? What's the purpose?
Yes, we've been doing this for quite a while, and we had a contract. And when this came to my desk, I was like, I don't think this has ever been reviewed by legal, so. I wish I would have thought of it a lot sooner and had it all done, but it came to me that, hey, we need to do this, so we will spray,
Okay.
so I sent it.
It should have been intergovernmental agreements all along because you got one municipal organization agreeing to pay another municipal organization, and it just kind of establishes, hey, these are our trucks that we're using. This is the schedule that we're gonna do it in. This is how you're gonna pay us. So the intergovernmental agreement is essentially a contract, but because it's two government agencies, that's what you do.
So.
Only doing it in-
Okay, do we have the first and second on this?
Yes.
Okay, I'm sorry, I couldn't remember.
Thank
you.
That's why we're discussing this.
Well, I can get into that point.
So are these the only three areas that this is being done in? Or there's other agents, other areas that we're spraying in that will need these also?
Yeah, we spray in the unincorporated county,
Mhm.
and then these are incorporated, so we did an agreement with them.
Okay.
And then some of our incorporated areas have their own, they spray their own communities.
Okay.
But these three we've been doing 3 or 4 years or maybe longer than that. Yeah, well, yeah, no problem. So it's been a while.
Any other questions on the matter? So this is a one read. So again, it's a resolution authorizing the Jefferson County Health Center to provide mosquito control services to obviously Soto, Hillsborough, and Kimmswood pursuant to the intergovernmental agreement. We have a first and second. Is there any other discussion points? Not hearing any, please roll call.
I don't know if people understand how this all works, but as Steve said, we can't provide services in incorporated areas unless they invite us to do that. And so these agreements allow us to do that and for them to pay us for it. But we do all of the other unincorporated areas around the county. We've been doing mosquito control for, oh my gosh, probably 15 years, I believe.
2000, at least 2002.
Right.
So 20, yeah, because Steve started the program when I came here.
Yeah, and there's a lot of other activities involved in the program as far as trapping mosquitoes to test for mosquito-borne illnesses and those kinds of things. And so, you know, it's really something we really like the people to be aware of, and something that I think it's a good example of a program that we felt was needed around the county and stepped in to do it. And they had been doing it for that long. Basically, I know we've gotten grants and money in the past, but you know, a lot of that activities is paid for by the department.
Yeah, we haven't received a lot of grant money through that program. That's been mainly the tax funding that does this.
Thank you for that information. Is there anybody other information, any other questions?
Question, going forward, do you anticipate other municipalities getting contracts or contracting with the health department in the future?
We're open,
Just those
if they
three.
want to come and talk with us, I mean, yeah, we would do that for sure. I think we've got the equipment to do that. Good point. Like I said, a lot of the larger places have their own programs, maybe their own spraying.
Like percolating, I don't know how effective it is, but they have their own. I was wondering how effective the chemicals are, if they're not going through the health department. Doesn't matter, I guess.
Well, there is a technique of when you apply and how much and the speed of the truck and the droplet sizing. There's a whole science just in the application of the treatment, yeah. And we, I know we work with a lot of those cities as well. We help them if they need it. We do a lot of trapping within the city limits, different areas. And we'll let them know if we have a positive trap site so that they can respond to that with their spray trucks.
Great. Thank you.
Pretty involved program. It's a very interesting.
Okay. Now, hearing any further discussion points, and again, this is to approve the resolution authorizing the county to go into intergovernmental agreements for the solar for the Borough Filter. Roll call vote, please.
Mr. Page,
Yes.
Dr. Henry,
Yes.
Mr. Deal,
Yes.
Ms. Hill.
Yes.
Motion carries. All right, I guess Mr. Sykes, you're up with strategic, or someone's up for strategic planning and summary of.
Yeah, I'll start out. If you have any more questions, I'll bring in the heavy hitters for those questions. Miss Melissa. So yeah, I touched on it a couple of times, our strategic plan. This is one of the many projects that we have that we're trying to get through. If you'll remember, I think 2023, several of you went to the Civic Center and we sat down with the La Piana. It was a company that we hired and we went through a strategic roadmap, basically, of the beginning processes of this plan. So a lot has happened since that time, but we're back on track trying to complete this. And like I said, May 1st, the admin team, we got together and Melissa headed this project. And she kept us organized and in line and on track. And we went through this and we feel we have it in a draft form. And what Melissa provided tonight is like the first 3 or 4 pages, I believe, of the introduction and the background. And then we will be sending out the actual draft. I think Reed, you'll be working on some.
Yeah, I should
Yeah.
have that completed, but the week after 4th of July. I'll get that to you guys.
And the plan is, we like to send that out to the board members for them to review. And then send us any questions that you would have or comments prior to the July board meeting so that we can work on getting that information for the board meeting. Because it could be a long process to try to sit and review this all during the board. So the strategic plan is a 5-year plan. And it's made up of, we have 4 strategic priority areas that we're gonna put in. And each of those priority areas are gonna have about 4 or 5 objectives that we've listed out. And then with each of those objectives, there's 3 or 4 action items that we came up with. And some of these are projects that we're gonna be close to completing. Some of these are longer term projects. It's anything from community relations to the building updates to how do we employee morale type issues. So we're trying to cover a lot of different avenues with our strategic plan. And again, it'd be a 5-year plan. And we would have a dashboard on our website. You guys jump in if I get this wrong. That would monitor our progress of where we're at with our strategic plan. I think sometimes that happens where you put the plan together and then you put it on a shelf, and we're trying not to do that. We want to have this as a working plan. We'll visit it routinely and make sure we're still on track. Are there any changes? So again, we'll send this out to you in a draft form. So it'll say draft all across it. Please read through that and send back any questions or comments you have. You don't have any of the objectives in what we gave you, you'll get that later. And I appreciate the admin staff, but especially Melissa, she really took this on, and kept us going. I know Brian had a hand in it too, but, we, this isn't my thing, and I appreciate people that this is their thing, and she does a real good job at it. Any questions on that? Yes.
Brian said she could have that like by the second week in July. Is that like a fast turnaround for us to get everything in for the next meeting? Any suggestions or comments? Is it?
Truthfully, I can have it for you by Saturday if you'd really like it. I just gave myself a buffer in case, but I probably could, so, sorry.
We only got like a week before the next meeting after that, so.
Yeah, I mean, and we can have some discussions I'm not saying we won't, but it just make it easier, especially if you had time to look at it prior. And then you can get it to us prior to that, if not bring it to the board meeting. But I know it's hard, you don't want to be handed a document at the board, and not be able to have time to review it. The other thing is, yeah, this is what we're gonna use to guide our direction for the next 5 years, so it's fairly important. And we got a lot of our admin staff will be at a conference, so it's probably just gonna be Jay and I. So if we can get questions ahead of time that we can all sit together and kind of go through, it'd be great.
So let me ask, you said, could you potentially have that like maybe Friday after the 4th or that following Monday?
I'll make it
Out to everybody?
I will make it a priority tomorrow and I will get it to Jetty.
You don't have to do that.
It's not a big deal.
Nobody's gonna look at anything until I.
Okay, yes, I can definitely have that done.
That we email everybody, that we have them digested. And if there's any ideas, changes, send it back to Brianne, I guess, or send it to Steve or.
You can maybe send it to the communications or something, that way all your stuff stays funneled in or something. I don't know, however you want to record that.
Well, maybe we just send it back to you. I want to kind of funnel in and out to one person that way.
Yeah, I'm just gonna send it to Jetty. She can get it to all y'all.
And then we'll funnel it for anything we have coming back, funnel it back to Jet. That's good. Good.
We put it on the 8th, that's almost 3 weeks.
That's what I'm saying. That's.
Yeah, that's plenty of time.
That's what I'm saying. Even the 8th is probably, Monday, that following, like I said, it's. Well, the 8th is.
We just want to make sure you have plenty of time with review.
Yeah, what's I'm saying? Make suggestions, all right. We'll go with that.
Then you say, please, again, folks are aware. Not only is this something that you obviously should have. In order to keep the program on track, but it is a requirement for accreditation. And when does our current accreditation end?
2027, October or September of 2027.
27. Yeah, so we'll be good for that.
So any other discussion points on that at this? Okay. So next on the agenda is entertaining topics for the next agenda. So anybody have any topics? Nothing? Guess I'll entertain a motion to adjourn.
Motion to adjourn.
First or second? Any first or second, any discussion points? Not hearing any, all in favor, please say aye. Aye. Any opposed? Motion carries. Everybody have a good 4th of July. Be careful.